Good evening, everyone. Welcome to our second Zoom session of the semester. I hope you all are doing really well, and I don't know how the weather is outside of Nashville, but it definitely feels like an early spring for us right now, and everybody's kind of in t-shirts and shorts, and it's a little strange, but I am enjoying it. So our agenda for this evening is to I wanted to give you all some open conversation time and just kind of open up the floor for a while to see if you all had any questions about the policy project assignments. I've been in communication with all of you at this point and giving you some feedback, but just wanted to open the floor for some general kind of comments and questions about that, and then to just kind of go over some additional kind of course details and talk about comps a little bit, which is coming up in about a month or so, I guess, and just to kind of talk about prepping for comps as it relates to this course, and just kind of going over the rest of the schedule for the semester, and then as time allows, we'll go over a little bit from this week's interventions lecture around, I thought we'd touch on self-care and boundaries and negotiating some of that when working with families, so children and families. So that's our agenda for this evening. So we'll go ahead and open up the floor to you all to ask any questions that you all have about any course content or about the policy project assignment, which is coming up due on March 7th. So you've got about 2 more weeks to finish that up and get that in before your spring break.
Is there any limitation on how many references we can have? Because if we're all getting several references, there might be a but.
Yes, no, there's absolutely no limit on references. The more, the merrier on that one. Yeah, as long as they're in APA format, it's all great. Yes, I can imagine that you would have quite a few. Good question. So it looks like from looking at the folks who are here that we have representatives from, I think, all of the groups at this point. Would love to hear from your groups to just kind of have a check-in and see how things are going, see if my feedback was helpful, and if there were any kind of immediate or questions or concerns that you all had.
Well,
I'm sorry, whoever's talking right now, it's kind of impossible to hear you. There's some feedback.
Oh, I'm sorry. I don't know why. So maybe an echo.
Okay. Yeah. I think that's a little better maybe. Okay. You could try the chat function too, if that's helpful. Yeah, I'm not sure what the issue was. Does another group want to go? Would love to hear from you.
Our group is doing pretty good. We kind of split up the sections that we wanted to do, and we chose which one we thought would work best for like our expertise, and then we're all writing it, and we're going to come together and put it all together into one big paper.
Great, that's awesome. Yeah, this paper, perhaps more than any other of your group projects. Well, I don't know that I can say that, but just it's really critical that everyone comes together in the end, and that you have a clear kind of theme and flow throughout your paper, because otherwise it's going to feel really disjointed, and you may not kind of be able to make the points as explicitly as you could if you didn't do that. So I'm really glad to hear that you all are doing that. That's fantastic. I'm sure it'll make a big difference for your paper.
Our group has one girl that's going to do the general putting everything together so it has one voice. We're turning in our stuff to her and letting her basically proofread it and put it together and marry it so it sounds, congruent.
Mm-hmm. That's good. That's definitely another strategy, and it's no small load to take that on. So but whatever, if that works for your group, then that's fine. And I think that probably will make a big difference as long as everybody who's submitting the work to that person, does pulls their weight and does their share. So the last thing y'all want is for people to have to rewrite what you're doing, I'm sure. So sure y'all understand that.
I'm really appreciative. I don't like that part. So
Yeah. Yeah, it's not an easy task. It's not an easy task at all. Well, good. Are there any questions about the assignment itself or anything in the instructions that you need clarification on or anything like that? Okay, good, Katie. I'm glad to hear everything is going well. Thanks.
You mentioned that in the rubric that you're going to take in everyone's feedback when you are grading the paper, or you're going to take in the whole paper at one grade?
Yeah, so that's a great question. So what I do with assignments like this and why I ask you to submit those detailed group evaluations is because I will grade the paper as one grade, but then based on the feedback that I receive from your individual members of your group, the grade for individual people may change based on that feedback. So you essentially get individual grades, but they're based on both your collective work as well as the group evaluation statement. And typically, just to give you a little bit more detail about what my process for that is, the things that I look for are consistency. Well, first and foremost, honesty. It's important, that you all are honest with me. And if you feel like your group is having issues now, you definitely do not have to wait until the end of the assignment and kind of go through all that and then tell me. If you have any concerns about the kind of group cohesion or dynamics or anything at all, please go ahead and let me know about that so I can work with you to address any of those issues and provide support as needed. But I do look for consistency in those, and it's pretty clear. It's also clear to me when I see that it's sort of a repetitive, I kind of see the same people writing the same thing over and over. Or you just kind of wrote one thing and then everybody submitted it. That's clear to me too. But if there are significant discrepancies or issues that are not, that I feel like based on your writing, I don't fully understand, or I still have questions or have other kind of concerns about, I will actually reach out to either the individual person or your entire group and perhaps ask to have a video chat about, about those so that we can kind of talk about it all together and get on the same page. So that's how I handle those. So it's a combination. So you receive an individual grade based on the collective paper and the individual feedback you give me. Does that answer your question?
Yes.
Okay. Great. Good question. Okay. Well, if there aren't any more questions or updates about the policy project, I will just assume that everything is going well and that you all will contact me if you need some additional support or have some other questions. I'm here for you. I know that this is probably the part of the semester where you all may be feeling some stress and have multiple projects due and all that. So I definitely understand that things can get hectic. So March 7th by 10:59 p.m., those papers are due. Just the submission instructions are included in the assignment instructions. But again, let me know if you have any clarifying questions about that. So following March 7th, we have a break the week of March 14th. So there's nothing going on as far as additional content for that week. You will have a clean break there. Then we will get into overview of trauma and violence, and all of the material is already up. There's a few articles here and there that I still have to post for you all, but those will get put up before those units come around. On March 28th is our final Zoom session, and because that is the week after comps, we won't have a chance to meet prior to then to kind of answer any questions you have about comps. So I definitely want to give you all some time this evening. Maybe you haven't really thought about that, or maybe you have thought about it a lot, but so we'll get a chance to talk about that tonight, as well as feel free to email me if you have any questions about that, but I'll go over that in a little more detail in a second. And so after the Zoom session on the 28th, we will move into the assessment instructions. So I will go over instructions for the final assignment for this class on our Zoom session on the 28th, and make sure that is posted. It may already even be posted, but I think I might have wanted to look at it one more time. But so if it's not posted, it will be posted towards the end of March. And then I think, yes, that's it. There's no more Zoom sessions for April. I kind of thought I had one, but okay. So that's it. So I will be in touch, and I'm still working to see if we can get a guest lecture for one of the later units. So I may be posting some links to recorded lectures and things like that. But other than that, you all have access to all the material that you need for this course thus far. So that's it as far as the kind of remaining course review. So this evening I did, kind of switching gears to comps, I did post some material that you probably have already received as far as the study guide goes. I posted a folder that says Comp Study Guide under the course materials tab. So it's right below the class sessions folder. So you should be able to access it. It's just a copy of some PowerPoints that are covered in Units 2 and Unit 8. Yes, Unit 8. And so the best, there's a question here, I think. Yeah, what is the best way to study for comps? So what I recommend with that is to focus on the study guides that you receive from the comps committee that you all get directly, so not from me, but from the information that you get from them, in addition to looking at the study guide, which isn't itself a separate guide. It's just highlighting and reminding you that the material is that, you know, the way that comp is set up is it's not asking you to recall details of specific journal articles. It's asking you to it's really more related to kind of general concepts, and the concepts for this course that are focused on are kind of fundamentals related to policy and policy analysis, because this is your, as clinicians, this is your advanced policy class, so that's one of the core pieces. Additionally, the federal The federal policies that you all are reviewing for your policy project are also important to study. And you have the tab on Blackboard that has that big long list of about 10 federal policies. And under the study guide folder, there is a PowerPoint that really does a good job of summarizing the federal policies related to child welfare. So that would be a really helpful tool to study and kind of further understand those. And a lot of those policies are really, really long. So I wouldn't in terms of how do you study for this, I wouldn't focus on, trying to memorize every last little minutia of the policy. It's really going to ask you to look at the bigger picture. So what are those core concepts that those policies are trying to address, and how are they trying to address them? And I think the PowerPoint does, and kind of the historical significance of it too, and how those policies really relate to practice with children and adolescents, because those policies really do shape the systems and programs in which you all work with children and families. So that's why those that's why the focus is really on that policy piece.
Professor?
Yes.
You had several questions on the chat.
Yes, I'm aware. I was getting there. Thank you.
Sorry, I just didn't know you had it pulled up. I was worried.
Yeah, no problem. So that's my attempt to answer the question about what's the best way to study for comps. So I'm not sure I understand, Jimmy, your question. Is that material just for your course? I'm not sure I understand that question. What do you mean? What do you mean, Jimmy?
I think it may mean, is it just for your course, the stuff on the study guide you posted, or is it for the entire exam?
Oh, yeah, no. It's just as it relates to my course. Yeah. That's just as it relates to my course. The exam, is the exam similar to the practice quiz? Yes, it is very similar to the practice quiz. That is the purpose of the practice quiz. The comps is not essay form at all. The comps are going to be delivered in test form, like the practice comps that you all have access to. Okay, Jimmy, good, I got it. Okay, Katie, does that answer your question? I don't believe that anyone in your cohort is taking the essay comps. You all should be taking all the multiple choice ones.
Just another commentary out there. I would also recommend if you are have your phone, there's apps out there you can download. There's one on Masters of Social Work exam prep that can help you prepare for a comp in one question a day, to kind of those type of thing to help you prepare. I'm graduating a little bit later than usual, so I'm not taking with you guys, but it's just a great tool to help you guys prepare for licensure exam or whatever exam you have coming up. They helped me as well. So just a little tip out there if you guys are more techie type of people. So
yeah, thank you. That sounds like a great tool. One of the reasons why the university or the college decided to move away from the written test towards the multiple choice test was to better prepare you all for the licensure exams that you all will be taking, either at the master's level or at the LCSW level. So hopefully that would help with the prep for the comps, but I haven't seen it, so I can't speak to that directly. Are there any other questions about comps?
I have a question.
Sure.
When it comes to taking the exam, are we supposed to be registering for a prompted site, or just using our laptops like we do to do Zoom and stuff like that?
I think I understand your question. If I don't answer it, let me know. The format for delivering the comps exam is going to be on the Canvas site. So it's not actually going to be on Blackboard. It's going to be on Canvas. but it will be timed, and it will be open for that specified time period on March 22nd. And I'm pretty sure that all of the information that you all have received from the comps committee is, answers those types of questions. So if it doesn't, and I'm not on it, so I can't speak, I don't want to give you wrong information and make it more confusing. So I would say for those kinds of questions to contact the contact that it said, the person that it says to contact in those emails, which I'm sure is another faculty member here.
Okay, thank you.
Okay. I don't actually believe that the test is 8 hours. I think that it's 4 now that it's multiple choice. It might actually be 3. It used to be 8 hours when it was written, because you had to do, the whole thing, and it was long. So I don't think that it is 8 hours, but again, I don't want to tell you wrong, but I'm pretty sure it's about half that. Because we used to have it open all day, and then you would have to kind of manage, like you'd have to kind of schedule out your, your lunches and, when you would break and all that kind of stuff. But it's because it's multiple choices, you're going to move through it a lot faster. You're asking if the comp is on Central Standard Time. I honestly don't know the answer to that, because online you all are, across the world. And I know that the administration for Blackboard and Canvas is on Eastern Time, which is why I'm always putting those weird times like 10:59 p.m. Central Standard Time. It's because I don't have an option to go later. And I want to make sure that you understand that last little minute matters, because I'm kind of tied to that Eastern Time and running out at midnight. So I honestly can't answer that question for you. What I can tell you is that everybody who took this selective, the 571, that you all will be getting questions that relate just to this selective. So if you took evidence-based practice with children and adolescents, you'll get a portion of the test, kind of a module that's just for this class. And then if you took families, you'll get questions that are just for families. And if you took older adults, you'll get questions just for older adults. But other than that, the test will be the same bank of questions for all students. So I believe you may get a prompt that says, or actually, no, I don't think you're gonna get a prompt. I think it just gets delivered to you because we have a record that you took that course. I think.
When will we know the results?
Immediately, just like a quiz. It's pretty cool. When it was written, you had to wait for all of us to grade it. So, but now that it's multiple choice, you'll get it back immediately. I say that. Oh, now that I say that, I thought that you got it back immediately, but there may be a delay just to make sure that we don't have to throw out any of those questions, just like we do on a quiz. I'm not sure how many questions, but I'm pretty sure it's a lot. Yeah. And again, I'm sorry, I can't answer those really detailed. I was kind of wanting to talk about comps just as it relates to this course, to make sure you had access to the kind of information that would be covered on that. I don't honestly know. It's the next Friday. Okay. Yeah, I thought there was a little bit of a delay, but not nearly as long as it was for when we had to grade them by hand. There may be 100 questions. I honestly don't know. I'm sorry, I don't know the answer to that. I'm going to write it down, see if I can get some more info. And again, you should be getting all of the details for those kinds of questions directly from the comps committee. Yeah, exactly. Yeah, I was like, I know y'all have access to this info. Okay, so in the Canvas site, yes, and there is an instructional Zoom with Professor Veit, I believe. So I'm sure that's really going to be helpful for you all. So I'd say if you're starting to study for that and all that, to make sure that you review all that information, because we definitely the comps committee was really intentional about trying to get you all some the information that you needed in a timely manner. So and if you're not getting it, definitely please let the faculty know so that they can answer your questions. That's definitely what we're here for. Not me, because I'm not on it, but everybody else who's working on it. Okay. Are there any other questions that hopefully I can answer about comps as it relates to this material from this course? Is it easy? No, it's not easy. It's comps. Maybe it's easy. I don't know. I'm sure for some, I think it'll probably follow the bell curve as any other class does. So yes, this is graduate school. So all I can say is we spent a lot of energy and effort trying to develop a good comps exam for you all. So hopefully when you take it, you all will see that. Okay, so in our time left, I wanted to have a conversation about, I'll go ahead and pull up my share screen. So I wanted to touch on some concepts from this unit that are around self-care. And I know that many of you in your other courses probably talk about self-care and talk about boundaries. And great, I'm glad that you do that. I would also like to talk about it here because it's one of those things that can absolutely, without exaggeration, make or break your career. It's absolutely critical. And it's really, really important. So we're going to go over this a little bit. And so yes, self-care is very much needed in graduate school. So one of the things that I wanted to touch on is part of self-care is boundaries. But before I jump in there, we've got this little wheel here for you to consider, kind of highlighting just the different domains of your individual wellness. So everything from spirituality to, financially what's going on, which as social workers and our earning income is not the highest. So that may kind of be a continual concern. There's environmental issues, social, physical, intellectual, emotional, different aspects of wellness and well-being. And so I would love to hear from some of you about what your self-care plan looks like. How intentional have you been, especially as you are balancing and juggling, your classes, your field placement, possibly some work, your families, your friends. How are you balancing all of that? And do any of you have some strategies that have really worked for you that you can share with everyone else?
For me, one of them self-care that I found very helpful. I've always loved to drink green tea. There's a lot of research out there that proves green tea can help relieve a lot of those stress that is going on. I would usually drink that before every quiz or every final exam or something. That should always help me. But recently, I've been going out to the gym a lot. So all that physical activity can help you with self-care as well.
Yeah. Thank you for that. There's definitely a lot of research that supports that your brain actually functions better. You can retain more information, download new information, as I call it, and essentially kind of clear your head all through physical activity. And so it's one of those things, if you're really stressed and you're studying a lot and you have a lot to do, you may feel like, oh my gosh, I just have to sit in this chair for another hour, but you've been sitting there for 3 hours. You're probably going to get more done if you just get up and walk around for a few minutes, and then come back to it, with a fresh head. It also supports creativity. and just supporting the different parts of your brain and the neurochemicals that are released when you engage in physical activity. So definitely support exercise as a self-care plan, part of your self-care plan. Good. What are some other things that have worked for you all?
I have 5 children, and it's been kind of crazy since I started grad school. I got diagnosed with cancer this year as well, so it's just been a nut house at my house. So I told my husband last semester that I needed some self-care, and so he booked me a flight for Florida for the week by myself, and I literally went to the beach for a week by myself, and it was amazing. So I recommend that for everybody.
Yes. Yeah. Even if, and thank you for that. And sometimes, flying off, and bravo to you for actually saying yes to that. And bravo to your husband for making that work financially, or for you guys together. Yes. Awesome husband for sure. And, that's where I was in January. You probably got an email saying, I'm out this week. I was at a retreat at the beach too. Definitely. That was part of my self-care plan for this year for sure, in action. But there's also, I think, part of the piece of that's really engaging in self-care is just figuring out what it is that you need and actually asking that question and then following through with it. And so if you don't have the means or the time to actually physically go away, or somebody to take care of your kids, there are small things that you can do that can kind of give you that break. If you live in the Nashville area, which I know many of you all do, and even if you don't, there's probably similar things. But there's a retreat center just right outside of town, kind of on the west side of town, that's called Pignol Ridge. And you can it's like 123 acres. It's absolutely beautiful. There's hiking trails, there's places to sit, there's a fire pit, there's a little rustic cabin you can stay in. You can stay in the house. There's a well that you can just kind of sit and meditate in. It's just a beautiful piece of property, and it's open for people to come and just be there for the day. It's open for people to go and stay. I think it's just a few dollars, like $25 or something a night. Maybe it's a little more, but it's not as much as flying to the beach, which is fantastic. But whatever you can do to, really kind of take that break out, even if it's just staying in bed for 10 more minutes and, closing your eyes and, sending love to yourself, or meditating in some way, or just focusing on something outside of yourself can help too. So good. Thank you for that. Let's hear one more. What's another strategy that has really worked for you all? Medication. Yeah. Sometimes it's what you need. Sometimes that is what you need. And, figuring out what works for you is definitely what really matters. So, and, one self-care plan is, it's going to look different from person to person. And it's important that it's individualized for what you need. Just like when you're working on a treatment plan with a client or a family. Okay. So moving through this a little bit. So one of the things that, in clinical terms, when you're actually sitting in that chair, and since I'm not a clinician, I can't talk in major detail about this, but there are pieces that are really relevant kind of wherever you are within the therapeutic relationship. And DDT skills, so the same things that you all will learn in your clinical classes, can definitely, you can match them with yourself and apply them to yourself. You can also practice mindfulness. And this is, again, in both inside and outside of your clinical sessions. And that's really going to challenge you to figure out, how do you, if you experience pain or you're engaging in a difficult situation, how do you simply just tolerate it? How do you kind of take a step back and play the observer in that, and learn how to tolerate that, how to address those difficult situations, and you're challenged to not change it, because sometimes you just simply can't. And the skill building around that is simply holding space for that for yourself, acknowledging the emotions that you're feeling, and really, sitting with it, without judging it, without trying to change it. And it actually can help you over time. And it's a good skill, mindfulness just in general. And there's a lot of research on the internet. There's trainings. There's a whole evidence-based practice with, mindfulness-based stress reduction, which is a fabulous training if you all can attend that, and can really help both you and your clients. So that's one thing you can do. There's other skills like distress tolerance, which is essentially asking you, how to ask for what you need and say no while maintaining, self-respect and relationship with others. So again, it's kind of holding space for things that feel uncomfortable. And I think somebody said on the chat earlier, just simply learning how to say no truly is a skill, especially as social workers. We always want to help, whether that's a family member, a friend, or a client. A lot of times we are, it's simply what we do all day is we give and we give and we give and we give. But do we give ourselves that same energy as, we give other people? And if we're not, why not? Because we really can't, there's the ability to get burnout, the capacity to get burnout is really, really, really strong when we don't know how to say no. So learning how to say no and asking for what you need, it really, truly is a skill. Interpersonal effectiveness is really looking at, how to change the emotions that you want to change, and identifying and understanding if you are having an issue, if you are experiencing extreme distress with a certain situation, how do you learn how to navigate those emotions? And attending to that, maybe going to see, your own counselor to put in place some of those same practices that you use for your own clients, maybe what's needed. And emotional regulation is about the practice of being fully aware and in this one moment. And it definitely kind of goes hand in hand with mindfulness, where you're really kind of playing that observer and also really being fully aware of what's happening. And this is really critical when you're looking at, when you're in a situation where you're being triggered, and simply being aware of what those triggers are within the clinical relationship. And one of the things about working with kids, if you do engage in, therapy with children, or, working with children and families, we were all once kids ourselves. And so seeing something happen to a person at a certain age can actually trigger things that happen to us at that age. Or any, that's just one example. There are, triggers are very, very personal and very individualized based on your history and your, just past experiences. But it's one of those things that sometimes it can get a little confusing, and you have to be aware of transference and things like that. A lot of that I really hope that you will get into with your in more detail with your clinical classes, but it's one of those things to just simply be aware of, and know that just like you have your own self-care plan and it works for you, understanding what your triggers are, being self-aware with that, and then using the tools like distress tolerance, mindfulness, and just understanding how to navigate and self-regulate through those triggers is really, really important. Is that a question to everyone? What is your self-care plan in grad school? Or are you asking me, Katie? Oh, you're asking me. What was my, oh goodness. Wow. That was a long time ago. I'm trying to remember. I'm sure that it was imperfect. I'll go ahead and be honest with that. I feel I have definitely gotten better with self-care as I have been in practice longer. What I remember about being in graduate school, which for me looked like working full time, having an internship placement, having classes, of course, and then I also had health issues, went through a divorce, and I commuted 90 miles a day. So I didn't have children, which I know if you have kids, I'm in total awe of you. But so I didn't have that, but it was very, very intense. And what I did for me that I think sticks out the most is I simply just, if it got to be too much, I just stopped. And I know for some people, they really like, whatever your work ethic is or whatever it is, it's like, yeah, exactly. The things we do for an education, it's like, we'll just push through, persevere. Like, I'm sick, I don't go to the doctor, I don't have time, all this kind of stuff, where it's just like the work or the school or the whatever is, we put a priority there. I've seen that a lot. I actually just got a horrible picture from one of my good friends who did not take care of herself and wound up with a really horrible infection and had to have surgery, simply because she didn't, take care of an issue earlier on. So what I did is I actually took care of those issues. So I did go to the doctor, and if I needed to take the day off, I took the day off. And so I think I definitely tried to practice taking the time that I needed to take care of myself, because I knew if physically I wasn't healthy or, I wasn't kind of getting whatever it was that I needed to just address it and not put it off. So that was what I did. I'm sure that it was imperfect in many ways, but that's what I had. That's what I got for you. Thank you for the question. I appreciate that. So one of the most critical things, kind of regardless of whether you're a clinician or you're anywhere in practice at whatever level, you as a social worker, because of the work that we engage in, and that it's constantly, we're in interpersonal dynamic situations and working with clients who may trigger us because of their stories kind of are similar to our stories, or they're just very hard to hear, or you have conflict of some kind with your supervisor or another colleague, you're going to get triggered at some point. So it's not really a matter of if, it's a matter of when. And so there are specific things. This list here is not by any means exhaustive, but there are some very simple things that you can do when you do get triggered in a clinical session, especially because sometimes the needed response is to literally get up and remove ourselves from the situation physically. But when you're in session with a client, you really can't do that. So you have to figure out, again, how to sit with that uncomfortable feeling. And sometimes the answer is to simply breathe and breathe through it. There are things that can go along with breath that you can do when you're sitting. And again, it kind of goes to your self-care plan that is very individualized for you. So my recommendation would be to practice and just figure out what works for you so that you can kind of like, all my people who've played, all you guys who've played sports, you know how kind of muscle memory works. It's like, you don't know how to ride a bike when you're little, you can get on it now and you'll pretty much know how to ride a bike because you have that muscle memory. When you practice these skills over time, it will kind of turn into muscle memory, only it's more like brain memory. And you just will kind of do it automatically without thinking. And that's really where you want to get to, because sometimes when we're triggered, if you remember from neuro, your amygdala is firing and you could potentially feel unsafe, or you may just simply feel uncomfortable and have to learn how to move through that. So breathing is critical. There are things that, just in through the nose, out through the mouth, 3 deep breaths, actually lowers your heart rate, increases your ability to think, helps your amygdala kind of calm down a little bit. There's physical things you can do. One of the things that I like is to kind of deal with stress is, I don't know if y'all can see this, but there's mantras that you can do, like as you breathe, you can say whatever it is that, I am safe, I am calm, whatever it is on your fingers, find something that that feels good to you and works for you, and you can kind of actually have that tactile experience along with your breath, which may be a little more powerful, especially because you can't necessarily stand up in a session and kind of ground down through your feet or anything like that. So there's just those little things that you can do without being noticed, because you can just have your hands in your lap and kind of be doing some of those things, or also just kind of generally practicing mindfulness, feeling yourself in the chair, knowing that you're okay, breathing. And then there's so that's kind of the physical pieces and the physiological pieces. You can also do something very simple, which is just to return to the client goals. So if you feel triggered, or there's a tangent happening, just kind of it's another way of centering or grounding, is to kind of return to the purpose of why you're here. And that can also help you refocus, and then also help your client refocus as well. Using empathy and compassion, absolutely. It's for your clients, but also for yourself. Understanding that, you're human. This is going to happen. There's nothing wrong with you. You didn't do anything wrong. It's just a matter of, having that self-awareness and knowing, when to bring that compassion to the fore, and empathy. And again, for yourself as well as your clients. Definitely practice healthy boundaries. We're going to have some exercises. We'll go through some scenarios in just a second. Setting limits. Sometimes you may simply have to kind of put the brakes on a conversation if it starts going to some place that's just really like you can't handle, or you feel like your client is getting really distressed and you feel it triggering you. Setting limits about, okay, we can address this for a certain period of time, but then we're going to move on, especially if it's something that it's going to be really triggering for your client as well. And then outside of session, absolutely can't stress self-care enough. The thing here about the example that you brought up earlier about, your husband just saying, you know what, I see that you really need to get away, and I'm going to support you going to Florida for a week by yourself. Absolutely amazing. And it's also another example of how sometimes we need other people to help hold us accountable. Sometimes we need the support of other people to actually implement our self-care plan. So knowing what that is, and knowing kind of who your short list of people, or maybe it's long if you're really fortunate, but knowing who your short list of people that you can call, who can kind of be accountability partners with you on that. Maybe it's some of your fellow students. You can say, if you see me getting, really super stressed, please call me out on that. And, or whatever that looks like for you. It's not, so it says self-care, it makes it feel like it's all our responsibility. It's also other people, you can engage other people in that process. And also, just as kind of a side note, the whole trauma-informed care movement, which is, you'll get into some more of that material in the coming weeks, but part of what that movement is trying to do is acknowledge that, how stressful the work that we do is, and that, it's not just about what happens with the people or what happens with the clients. It's what our organizations and agencies are doing to support the people that work, and, for our agencies. So for kind of a concrete example that relates to self-care is that it's not, it also becomes, if you implement a trauma-informed approach within an agency, it's also the agency's responsibility to help with essentially the self-care of all their employees. So you would have a supervisor that was really on the lookout for burnout, and was specifically doing things to help support you to not even remotely get anywhere close to burnout. That's a very different scenario than we have a lot now, where it's supervisors can feel overbearing, or you don't necessarily feel safe with that person, or you don't have a good relationship. That's just a completely different situation in a trauma-informed setting. So I say self-care, but it also kind of has a little asterisk that, you really can engage with others to help you in that process as well. Okay, are there any questions or comments about, triggering or self-care or anything like that before we jump into boundaries? Okay. So Let's talk about boundaries for a little bit. What do you think are healthy boundaries? What would you all say are some definitions of healthy boundaries?
I think part of it is what you were saying earlier about knowing when to say no, especially about taking work home with you.
Yeah.
So phone calls after work and stuff like that.
Yeah, absolutely. And that's something concrete. I know people who literally leave their work phone in their car so that they can't look at. I never got there. I really wish that I did, but it was really hard for me to manage that. But especially now that we have email on our phones, that's a very modern thing. People didn't used to have this issue. Those boundaries were just set. They were either at work or they weren't. But now that's not the case. So we actually are responsible for dealing with that issue ourselves. So good call on that one. What's another example?
I've got a girl who works kind of under me, and we have issues with her getting too emotionally involved or attached to the clients. So while I deeply care about all of my clients, I do not stay up at night crying for them or even worrying about them. Really, when I leave work, I leave work. And she has not been able to do that. And it's really become a burnout issue for her because she can't control that. So she never shuts her brain off. And so she's just exhausted all the time. It's really become a big issue.
So how are you, can I put you on the spot? That's a great example. So how are you as her supervisor choosing to help her with that?
So that's an excellent question. I've just been brought on by the board of this organization as kind of a consult social worker to kind of see how they can improve things and change things. They're very understaffed and they're very under budget or over budget. And she is the only person that they really have as the sole worker in this shelter, but she's not educated in social work. And so trying to get her informed on why you don't cross those boundaries has been a struggle. I spoke with the executive director this week and actually told her that if she cannot understand this, or if this cannot be effectively communicated to a place where she understands, that we're going to have to implement strategies for her to separate her a little bit more from clients until she can set appropriate boundaries herself. It's crazy.
Yeah, sounds very reasonable to me. I mean, it's one of those things. It actually sounds exactly like an issue that I was just talking about with a colleague just a few weeks ago. Very similar situation. And the other part that I wanted to acknowledge is that it's if you look at the effectiveness of her in that position, because she's not able to separate, it's then causing more burden on you as her supervisor, more burden on the agency. I'm sure that she's probably much less effective at dealing with addressing the needs of the clients. And also it sounds like she's just one person, but in the scenario that I was talking with a client or another colleague, she was saying that there were multiple people on staff, and that so it was kind of like, you know how like with kids sometimes, you know, one will start crying and then they'll all start crying. They were actually having an adult version of that, where it was, you know, when somebody got triggered and really upset and wasn't able to separate, then it kind of created this cascading effect with other staff as well. So then all of a sudden you had more than one person, you know, 2 or 3 people that were also really affected and having a hard time separating. So addressing it with the person who's having that core issue is definitely important, and sounds like you're really well on your way to figuring that out, and also just sometimes having that hard conversation of just simply, you know, maybe this isn't the work for you. Like you will burn yourself out. You will not be able to, you know, address the needs of the people that you're working with. And it, you know, healthy boundary. It's not just, you know, mushy social work stuff. It's kind of life or death in a way that you just simply, you have to be functional. You have to be on point, and you have to bring your A game all the time. And if you're not able to maintain those boundaries, that looks like you can't, which essentially is, you can leave the job. But having that kind of being able to maintain compassion in the moment, and then compassion, for yourself when you, are off hours. So great example. Are there any other thoughts about kind of how you would define healthy boundaries, or some examples of what that looks like?
My mom is a nurse practitioner. A lot of time I've seen people who will bring work to the home because we have access to cell phone, things like that. So they can hear them talking to another colleague about a client problem, and that can be an issue of confidentiality. So what I would do personally, because I am like a practicing social worker, and I would just kind of leave the room and kind of have a private conversation with another colleague. That's what I would do. But if I would kind of just talk to any colleague. If you were trying to talk to another colleague on the phone, just kind of like give them space, or I don't know, kind of communicate with them.
Yeah. And, thank you for that. And I actually want to jump right into an example, because you kind of highlighted, a great example, which probably happens a lot. And I would love to hear how you all would handle this. So the example here you can read, but I'll go ahead and read it too in case you're on the phone, is, you're walking down the hall at your agency and you overhear one of your coworkers discussing a case. You might hear them laughing and saying what a pain this client is, with someone from another department. And when you say something to that coworker, he says, what's the big deal? He's an adolescent. He's a pain in the butt. Or, she's so borderline. So what is your response, and how would you all handle that?
Personally, I do not know the entire story, so I would not step in unless I know what the entire ordeal. But if it gets out of hand, that's probably where I would step in and say, what's going on? This is an issue that I need to be aware of. But at this moment, I do not know what's going on, so I would just stay out of it.
Okay. What are some other responses that you all would have? I imagine some of you might have even experienced this before.
I've actually dealt with something like this because I work in a group home, and it was more the staff that are parental figures talking like that. I actually said something to them because a lot of our kids overhear them even when they don't think they're being heard, and come into therapy sessions really upset about what they hear them laughing and talking about.
Mm-hmm. It's, like I said, this is actually a pretty common, realistic example. And, there's not, these in some ways are, not necessarily ethical dilemmas, but they're kind of along those lines. Is like, there's not necessarily one right way to address this. But it certainly is an issue. And I think, the issue of, confidentiality is just one of those pieces. If you can hear them, chances are, like you said, a client, and you had a very real example about how clients did hear them being talked to. I can't think of anything worse than being a client, especially in a residential treatment setting where that's where you live. And then hear someone who's supposed to be, have your best interests at heart, and, is responsible for taking care of you, essentially kind of talking trash. I can't think of anything. Well, obviously there are more things that are more damaging, but that's a really damaging thing for a person who's staying in in a setting like that, and then has to go to therapy and then kind of vent about your coworkers. I mean,
It's the interesting thing for me was the staff would come to our meetings, and when we talk about what's going on and the different things that are happening in the home, and they'd be like, I don't understand why these kids are super defiant. I don't understand why they're so disrespectful. And I'm like, well, 2 days ago, this one overheard you calling him a retard. So I can understand it, and like them being flabbergasted that, you know, we knew, because they tell us. And I actually brought it up with their supervisor about how, you know, even if they're just joking, these kids hear them. And if they want kids to stop being so defiant, they have to be more respectful, even when they don't think they don't feel like they should have to respect the kids. They feel like the kids should have to respect them, but they shouldn't have to return it.
Right. And
it's amazing.
Yeah. And that's also like that's a perspective issue. That's a values issue. That's definitely what I would consider a training issue, education issue, you know, how, you know, putting the point. And that's again where, I mean, things like a trauma-informed approach, you're gonna lay all that out on the line and you're gonna talk about issues of creating safety with people, and all, you know, and very clear examples where you can lead by example. And yeah, absolutely, that's a really that's a rough example. So, you know, these are the kinds of things, though, that, you know, when you are working in a clinical setting, you know, you may have to deal with, and figuring out, you know, how would you address it if you saw somebody who was really violating, you know, confidentiality issues, being disrespectful to clients, you know, understanding how, you know, how you would address that is important. So there are some, you know, some kind of, these are just some examples of kind of boundary crossings that you all need to be aware of. Sometimes it can be, and again, a lot of these are just, they're kind of maybe unintentional, like you might attend or frequent the same places, like maybe you live in the same neighborhood as a client, so you wind up at the same grocery store. Sometimes you may even go to the same church or place of worship. You know, just kind of maybe even have like a mutual friend or family member. So just kind of being aware of those things, and figuring out, maybe talking to your supervisor about, you know, how you would handle that. Or also, you know, one of the best ways is simply to talk about it directly with your client, so that you can say, you know, I understand that, you know, we actually live in the same neighborhood, so I might actually see you around. So, you know, how would you like for me to handle that? And simply, you know, put the onus on them and just ask them, because really that's the issue. You know, you're a professional, you need to know how to conduct yourself, but really how do you kind of attend to that, the safety issues and confidentiality issues with your clients, and having that conversation kind of upfront and directly can be helpful. Yeah. So, again, yeah, you might share mutual friends or have people in common. You know, sometimes self-disclosure can be a powerful tool to build rapport and be in the therapeutic relationship. And then sometimes there's kind of too much of a good thing. And I think if you are questioning, you know, whether or not you should self-disclose, then perhaps you shouldn't. But again, that's something to address, I'd say, with your supervisor while you are in your placements, and with your mentors, and people that you work with that have more experience than you, and kind of, you know, as you're getting trained in more, you know, clinical processes, you know, that's something that you will learn about more, is like how to use self-disclosure as a tool. But it definitely is on this list of boundary crossings, because it really can be kind of too much. Definitely, there are some pretty strict guidelines about dual relationships within the code of ethics. So ask you to attend to that. And there are issues like around just kind of physical touch, you know, hugs and touching. And that's just sometimes you know, I always meet people who are like, they're all like, I'm a hugger, you know, and there's some people like, I'm not a hugger, you know, don't touch me. So kind of asking people what's okay with them before you just go and do it is definitely a good idea. Can you all think of any other kind of examples like this that may be possible boundary crossings, but might, you know, they're relatively neutral, but they could go either way depending on how you handle them?
I come across this situation all the time in my internship, where like when you have a tight knit like group of social workers who work in a dialysis center, and they're really close, so they can tell like they hang out a lot in their home and go out doing lunches, things like that. They did one of those moments where like the they have a dual relationship, and so they kind of, I would say from what I saw, they put their like social life outside, and once like they hit them like 4:30, that's when they can like do whatever. But at the same time, there are moments between cases they will just chat randomly. It's a little complicated, but I see that all the time in my internship as well.
Yeah, and that's, that's one of those things that it's like we need support as social workers. We do hard work. We need it's really good to talk with peers, people who understand. So you all have a common language and common values, so it's really easy to bond quickly. And I can see that example happening a lot. It also can really come back to be not such a good thing. Sometimes people get promoted before, out of a peer group, and then all of a sudden you're in this relationship where you used to be really close friends, but then now you're having to supervise them, and you have to kind of deal with those issues, and you may know a little bit more about those people than you would as if you were just a supervisor coming in. I've seen people really take advantage of that. I had an example where I worked with a colleague who told me flat out that she had a situation where she was really good friends with her coworkers, and they were all, would go out and, go get drinks or have dinner or whatever, and just kind of engage in that social relationship. And then, turn around on Monday morning in their staff meeting and, kind of put all, air all the dirty laundry. And, even had a disciplinary action issue happen, as a direct relationship or as a direct result of something that happened in a social setting. So, again, it's kind of like, you could do that, but it's a little bit at your own risk, because you do have to kind of turn around and work with these people. So that can kind of go either way. And again, it's one of those things that may be relatively neutral, but depending on how it's handled by either you or the people around you could kind of go a different way. So something to be aware of when you think about healthy boundaries and how to maintain that. And again, it's about how you work with your colleagues as much as it is about how you work with your clients. So some examples, and these are definitely kind of outlined in the Code of Ethics as well, but some boundary violations are things like, giving or receiving inappropriate gifts, ignoring established conventions by making exceptions for certain patients, things like providing care in a social rather than a professional setting, not charging for services where you would normally do so, scheduling treatments outside of office hours. I mean, we always want to help people, but there's a certain limit to that. And it kind of goes back to those conversations about, how do you handle your phone, that you can look at your email, you may get a phone call, outside of office hours, when you're off, you're off. So how do you handle that? And what are your agency's policies around that too? That's also critical. Providing or using alcohol during treatment, obviously that's pretty obvious violation there, but you'd be surprised, unfortunately. And then something that's also a little more nuanced, but can have some real issues to your therapeutic relationship, is assuming a patient's values are the same as your own. Those are really important to understanding, as this is not, you don't want to make assumptions, especially when developing a treatment plan, that somebody may value something the same way that you do. And that can look a lot of different ways. So again, having those conversations up front with your client, asking those questions, not making assumptions, you'll definitely wind up on a better path. Like I mentioned before, excessive self-disclosure or self-disclosure that is not for the purpose of helping the patient. Again, if you always want to question your motivation around self-disclosure, and that's something that I think you'll get better at over time. So intruding verbally on your patient's personal space, breaching patient confidentiality. We've talked about that already. Making value judgments about your client's body or their lifestyle. That just kind of goes in that judgment pool altogether, to avoid probing for inappropriate personal information, using intimate words, inappropriate touching. These are all outlined in the Code of Ethics, but just as a reminder here that these are really critical, and they can be so damaging. And also, you just simply don't know. And, kind of going back to the example of somebody may value something different. Well, someone may interpret something different. You could say something that you think is all neutral and all fine, but because of that person's history, they may take that a very different way. So talking with your supervisors, asking your trainers when you go through different training modality, training for different interventions, asking these kinds of questions, what could this look like for this specific population? And, asking questions of your client, where you need to make sure that you're always on the right page. Okay. So let's go through one more example. All right, let's go through this one. I know many of you live and work in rural areas or small towns where this example may be very relevant to you. And it's, we'll talk about law enforcement and domestic violence, but, this same example could kind of be, just kind of different details may really apply just sort of depending on the situation. But so for this example, you live in a small community. You see a couple for domestic violence. She is a nurse and he is a police officer. This couple is doing good therapeutic work, but there is still ongoing work to be done, and they have agreed to continue working on their issues with you. One morning, you're running late for your next client or your next meeting, and you are stopped for speeding by your local law enforcement. The officer turns out to be your client and immediately refuses to write you a ticket, saying, "I am so appreciative of how helpful you have been to me and my wife." What do you do? How would you handle that? I'm sure that nobody would want a ticket. So you may just want to say, okay, move along. But it definitely does present an issue. What are some thoughts that you all have? No ideas?
I'm not gonna lie, that would be really hard to do. Like, I feel like I would have to pull up my ethical big girl pants and say, please write me a ticket. And that would just be really difficult.
Yeah, it would be. I mean, and how would you even have that conversation? Because in a lot of ways, they have the power in that situation, not you. You can't really demand that somebody, give you a ticket because you're not the one who can write the ticket. So if they kind of say no, what are you going to do? But I think, Alicia, in your comment, you make a good point is, maybe address it in the next session, and simply, addressing the power dynamic as well. And, always, you're going to build rapport, you're going to build trust by kind of calling a spade and just saying, last week, I just want to acknowledge, that you pulled me over. That put me in a little bit of a bind, because of our therapeutic relationship. And, I just wanted to talk about it and kind of put it out there. So it's definitely not, yeah. And Jimmy, inform your supervisor. Absolutely. Definitely don't want to be, hiding these kinds of things and then having it come back around and you be accused of something. So it's a sticky situation. And, this could be, you are somehow connected to, the child's school, or, think about like if you, since this is children and adolescents, just putting the example just kind of in different terms is, what if you were, your children were in the same class of a client, so then you're running into them at parent-teacher conferences, at school plays, at, PTA meetings, and then yet you've got this therapeutic relationship too that you're trying to maintain. And then, what happens if there's an incident between your children? I mean, it could be when you kind of live in a small world, it's or a small town, you know, you may have more of these examples. So understanding what your agency policies are critical. Talking to your supervisor, talking to your mentors, and kind of getting some advice about, you know, how you think they should handle it, and also just, you know, leaning into that code of ethics is a great place. Like you said, you know, Lindsay is just may have to really, you know, focus on that ethical behavior and kind of deal with it head on. So, yeah, and I think you're right. And sometimes the relationship, you may realize over time, maybe you don't know this at the beginning, but you may realize over time that it's a little too close. And it, you know, in those kinds of situations, it is appropriate to have a conversation with your client about maybe, you know, it would be more comfortable if, you know, you referred outside simply because there was kind of too much overlap. And that's definitely an option as well. So we will kind of close up here, but I do want to see if there's any other questions or comments about the rest of the semester or any of the other material, or just kind of see how, if y'all are able to move through those, the readings all right. And I did post the quizzes. I meant to mention that before. If you haven't seen that, the first 3 quizzes are posted. The last 2 will be posted in the next couple of weeks when we move through the rest of the material, but those will definitely get posted as well. And those instructions I tried to make pretty detailed and kind of self-explanatory. So hopefully you won't have any questions, but please let me know if you do. You're welcome to email me if you do have those. Are there any other comments or questions about anything before we stop? All right. Well, it's good to see you guys, and I look forward to seeing you soon. And I hope you have a great spring break. I hope that the comps go well for you. And again, don't hesitate to contact me if you need anything. Bye-bye.